My name is Javon Bay. I'm the President and CEO of Mercy Health System, and I want to welcome all of you to our Level 2 Trauma Press Conference. Today's a special day for us here at the Mercy Health System. We're proud to announce that after a very intensive on-site review by nationally recognized site reviewers in December of 2009, Mercy was approved and verified as a Level 2 Trauma Center for South Central Wisconsin, including Madison, by the Review Committee of the American College of Surgeons. The extraordinary achievement recognizes Mercy's trauma service for exceptional care for injured patients. Other hospitals in the area have lower state Level 3 and 4 designations, except for UW-Madison, which is a Level 1 facility, and has teaching and research activities as well as other services to be Level 1, such as a trauma center, or a burn center rather, an organ transplant program. So the Regional Emergency Trauma Center at Mercy Hospital Janesville and UW-Madison are the only Level 1 and Level 2 American College of Surgeons verified trauma centers in South Central Wisconsin. You might pick up a map before you leave, and you'll see that south of La Crosse, Wisconsin, Mercy is now the only Level 2 trauma center in this part of the state. There's actually quite a few north of La Crosse. North of La Crosse, Wisconsin enjoys about 5 Level 2 trauma centers. South of La Crosse, Mercy will be the only one, and then along with UW as a Level 1. I wanted to share with you why Mercy did this. We made a commitment 5 years ago to want to reduce the regional trauma-related deaths in South Central Wisconsin. We made a commitment to provide leadership in this area by making a commitment to bring on additional medical staff, ancillary staff, and capital resources, to expand our EMS training services, and to provide community outreach programs. What we've committed to is a continuous quality improvement as defined by the nationally recognized authority in the United States for trauma care, and that's the American College of Surgeons. So it isn't just a one-time verification process, it's an ongoing commitment to continually keep state-of-the-art services for trauma care. A very rigorous process has occurred over the last 5 years. We've committed over $5 million to recruiting additional and new board fellowship trained trauma surgeons, hospitalists, neurosurgeons, plastic surgeons, cardiac surgeons, and orthopedic surgeons to keep our program staffed 24 hours a day, 7 days a week. To develop a state-of-the-art intensive care unit, to bring on new capital investment with new technology and upgrading our CAT scanners, expanding our MRI capabilities, expanding our catheterization labs, bringing on new trauma equipment such as the Arctic Sun for cooling the patient's temperature that comes in a state of trauma, investing in state-of-the-art training programs, certification for our nursing and other staff in trauma care standards, and hiring additional trauma nurses. In the next 25 minutes, panelists will discuss each aspect of our trauma program and how this level of patient care will benefit our local and regional communities. You're welcome to ask questions of our panelists and who are here, as well as of the other rest of the trauma team who's joined us. We'd like you to hold the questions until the presentation is concluded. I'd like to introduce our trauma team and panelists who are sitting to your far right. They're representatives of the various specialty areas, and feel free to ask them questions as they're a key part of our trauma program. Our featured panelist sitting left to right is Larry Grorud, who is our fire chief of the Janesville Fire Department. Next to Larry is Jerry Lighting. Jerry is the deputy fire chief of the Janesville Fire Department and head of the EMS paramedic program. Dr. Glenn Milos, to his left, is our emergency department medical director. And Dr. Rob Winnie is our lead trauma surgeon at Mercy Regional Emergency Trauma Center. Dr. Christopher Stern, neurosurgeon, will be joining us during the question and answer period as he's finishing up surgery. So maybe we can begin the presentations, and Larry, would you like to begin?
Thank you, Javon. I just have a few brief comments, but it's primarily to say thank you to Mercy Hospital and staff for bringing this level of care to our area. I go back a long way with the fire department. I was actually part of the first paramedic teams to hit the street, and we've had a great working relationship with Mercy Hospital going all the way back to the beginning of that program. It wouldn't have happened without Mercy Hospital, and that was 1975. We've seen continuous improvement in the program. We've continued to have a great working relationship. Our paramedic program has been able to reach out to the rural community through our Intercept program to get patients to Mercy Hospital where they're getting a great level of care, and this is only going to improve on that. As far as the mechanics of how we do that, I think I'll leave that to Deputy Chief Lighting, because he does a masterful job of coordinating our paramedic program and keeping it good. I really feel comfortable because back when I was Deputy Chief, that was my responsibility, and Jerry came in a number of years ago and took over that responsibility, and the reality is I haven't had to worry about it since. So I thank you, Jerry, for all you do for the program, and I'll give you a chance to talk about how we're going to interface with this new level of service right here in our backyard.
I too would like to echo the chief's sentiments. It's an exciting day for Mercy Hospital, and it's actually an exciting day for us in the field. This actually been a long process here for us for last year. I think was when Dr. Winnie came in, and the upgrades started happening. Dr. Miles came in, and so this has been a continuum of care. Mercy initially this year started out the boat with us, for example, providing defibrillators for us so we could impart on the beginning of the STEM-A program here, so we can get cardiac care patients taken to the hospital and get the care that much better. So today, and actually it's been going on for a while from my perspective, it offers the patients in the area, and like the chief said, we have an Intercept program that reaches out to sometimes 5 counties where we can bring patients here, and with them knowing that this is a level 2 trauma center, not only are they going to feel like they're getting better care, but they certainly are getting better care. And it's been a long time in coming. We're very excited to have this happen. And so, again, congratulations, Mr. Bay.